introduce our first honored guest speaker this morning, I just mentioned that she's from KPJ, and KPJ will be offering free blood tests from participants from this event today. So free blood tests will be given out by KPJ Damansara. It will be in the lucky draw. Actually, we will draw some winners for the free blood test from KPJ. Now, let me just give you a brief introduction to Dr. Nordiana Nordin. She has a medical degree from the University of Malaya, followed by further training in internal medicine and membership of the Royal College of Physicians in the UK. All right, she heads the geriatric unit in Hospital Sungai Buloh. And without further ado, I would like to now hand you over to Dr. Nordiana Nordin. Doctor, over to you.
Thank you, Derek, for the kind introduction. Hi, happy Saturday, everyone. Without further ado, I'll just proceed with my presentation. Just give me a sec. There we go. Can you all see the slide? So thanks for giving me the opportunity to talk about this topic, which is close to my heart with regard to the elderly, apart from dementia. So this morning, I'm going to talk about disease spells and falls in the elderly population. So dizziness and imbalance is a common problem in the older population. For your information, the overall prevalence of balance problems is about 36% among women and 29% among men at the age of 70. And balance symptoms are very common among women compared to men, and increases with age. So the higher, the older you are, the higher the prevalence of falls and dizziness among the older people. So you see it goes up to about 45% among those between 88 to 99 years old. The problem with dizziness in the older people, it persists compared to the ones in the younger population. It's just a transient period, but for the older people, it persists and becomes a huge problem amongst them. Falls is a leading cause for morbidity and mortality among the senior citizens. Why is it really important? Because once you fall, you develop this fear of falling. And once you have this fear of falling, they tend to restrict their activities. They stop doing things they normally do. They stop doing things they enjoy. For instance, walking around, jogging, brisk walking, or even reaching out for higher things, climbing up the stairs. So some of these normalities are being restricted and they end up being homebound. It is often a marker of underlying disease. Some of the common diseases that leads on to falls, for example, like Parkinson's disease, if you've heard of it, stroke, when there is impairment of the physiological disturbances of the body, they tend to fall a lot. And fall is actually the 6th leading cause of death anywhere. And at least about 5 to 15% leads to serious injury, and about 2% leads to hip fracture. How big is this problem worldwide? Well, falls and fall-related injuries are very, very common, and it's a serious problem among the older people. And again, the older you get, the higher the risk. So people at the age of 65 and older have the highest risk of falling, and these are the geriatric population. About 30% of people older than 65 develop falls at least once a year, and up to 50% of those above 80. Now, the problem with falls in the population is once you fall, I'm talking about the older people, once you fall, they tend not to tell the healthcare providers, they tend not to inform the caregivers, so they keep it to themselves. So another second or the third major fall leads to a bigger problem. What is the prevalence like of falls among our community in the primary care? So this was a study done a couple of years ago by Sazlina et al. This is a study done on 151 people of the geriatric population. So it is reported that 47% have actually had history of falls over the past 12 months. And 57 of them reported to have experienced recurrent falls. That means two or more fall events. And majority of these falls occur in two areas, which is the bathroom and stairs. So, you know, most of us have fallen before, but as you age, the risk gets higher. And up to 61% of these older people who fell actually sustained injury. This was a study that was done pretty recent by my colleague, Prof. Mauping Tan in who looked into 1,700 Malaysian community dwelling older people above 60 years old. And about 309, which is 17% of them, reported fall occurrences within the 18-month follow-up. And about 27%, that is a huge number, has had 2 or more falls. In this study, they have also found that having had history of falls accompanied with lower muscle strength were actual predictors of both occasional and recurrent falls in the future. So, you know, if you were to modify these predictors, it can be beneficial for falls prevention in the future and to go around the management strategies among the falls in older people. So these are the physiological changes in the elderly. The normal physiological changes that can give rise to the risk of falls. Now, as we age, we go through brain atrophy. That simply means our brain matter shrinks. And with time, we tend to reduce focus and attention. So, you know, whenever we talk to people or we are multitasking at the same time, we tend to lose this focus. This is just part and parcel of normal physiological changes. But with additional pathology, one tends to have a reduction in the memory, which is the cognitive function. So, you know, this gives rise to falls. Of course, as we grow older, we tend to get visual impairment, and due to that, we have problems in depth perception. So hence, as we age, you know, sometimes we're extra careful when it comes to walking up and down the stairs because we're not sure, are we really stepping on the right platform or not? Now, the common problem with the older people also, you know, as we age, we tend to wear bifocal glasses, which is not advisable for people who actually have both long-sighted and short-sightedness, because that obscures your eyesight and the way you judge on the steps that you take forward. Also, hearing impairment. As we age, we tend to, you know, have a decline in our hearing, and due to the vestibular cochlear changes, that also causes problems with our balance. Peripheral nervous system plays an important role in our balance issues and also the core, how do you say that, the trunk and core muscles. Now, if we were to have some issues as we age, for example, tremor, we also have issues with our fine motor skills, the way we grip the mug, the way we hold the pan, the way we hold the knives. You know, we may have developed some of the symptoms, and the main component of this is loss of sensation. So this gives rise to the increment of the risk of falls. And the main bulk of the issue of risk of falls is the normal physiological changes in our musculoskeletal system. As we age, we eat less, so there is lesser body mass. Of course, our mobility of the skeletal joints also reduces, and we have the not unusual or not uncommon problem, which is thinning of the cartilage, which then leads on to the common problem of arthritis, and also bone demineralization. This is more common among postmenopausal women. So you tend to get osteoporosis more in women compared to men. And at the end of the day, it increases the risk of fracture. So the causes of falls can be divided into two, which is intrinsic and also extrinsic. So intrinsic factors are anything that has got to do with our body, and extrinsic is anything outside the body. Most of the time is the environmental causes and also involving non-environmental causes. So what happens in this intrinsic, some of the intrinsic factors is cognitive impairment and mood disorder. So as I've said earlier, in part of the physiological changes as we age is brain atrophy. So this gives rise to a certain amount of cognitive impairment, and a combination of cognitive impairment with mood disorders such as depression also leads on to falls. As we age, we have sensory deprivation. For example, peripheral neuropathy in diabetic patients, in those with common neuropathy, you tend to have reduction in sensation in both your hands and also legs, and also feet. So what you step on is something that you don't realize, and then at the end of the day, you suddenly notice that, oh, there is already an injury, oh, there's already an abscess forming there. So this is part and parcel of risk to falls. Reduction in the body mass, the lean body mass also leads to generalized body weakness, or another example, if the problem is a central problem, for example, stroke. So when you get a stroke, you tend to get one-sided weakness, you tend to get hemiplegic or paralyzed. So this gives rise to the risk of fall because you're only depending on one side of the body. Also, joint problem is a common problem among the elderly people. The most common presentation is osteoarthritis, but also not to forget the common rheumatoid arthritis, psoriatic arthritis as well. That can also give rise to joint issues. One common movement disorder that gives rise to falls is Parkinson's. Why in Parkinson's? There is slowness of the movement. There is also loss of the truncal balance. So people tend to stoop forward to try and get that balance back. But chronic stooping forward and mobilizing with this slowness tends to lead them to falls because you lose that proper balance in your truncal, and also associated with tremor. The other common problem that we see among the older people is vestibular cochlear problems. So patients present with giddiness, patients present with dizziness, and chronic issues of this tends to lead to falls because of their poor judgment. A commonly unnoticed problem is postural hypertension. What it means by postural hypertension is a drop in the blood pressure due to the poor circulation around the body during a sudden change in your posture. So for instance, from lying to sitting or from lying to standing, it causes a huge drop in our circulation. So a huge drop in the blood pressure. So this then leads on to severe giddiness, and it also leads on to syncope. So syncope just simply means you drop flat on the ground with sudden loss of consciousness, and this can actually cause fatal apart from fall. So these are some of the extrinsic causes that contributes to falls. Environmental versus non-environmental. As we are aware, if you go to shopping malls, if you go to hospitals or some hotels, they have proper bathroom grab, but it's not something that we implement at home. So some of these places where we are lack of all the grab bars, these are the causes, these are some of the factors that can actually lead to falls, because the elderly need some kind of support as we grow older in order for you to have a proper stance or proper balance. Slippery floor is another issue. This is also a common problem at home. You tend to mop the floor after vacuuming and not realizing that you've done on this part, and then someone else just decides to walk on it, and then you just slip and fall. Obstacles and tripping hazards. This is very, very common. Even I have it myself because I have small kids. So you tend to have little toys around everywhere. So this is something that you want to think at the back of your mind. Remind yourselves to try and clean up your housing area and try to make it as spacious as possible. Unnecessary items or unnecessary little stuffs should be put on the side. Lighting and dim glare. So the lighting should not be dim or should not be glary. It should be white. It should be bright. But at night, we should have a little bit of light, side lamp, because as we age, the moment we wake up, we tend to be a bit confused. So, that really helps to know your bearings. You might be confused with the place, you might be confused onto where your bathroom is. So, this could actually lead to trips and falls. and of course, a poor stair design. Nowadays, you have matured housing areas. So if you go into matured housing areas, most of them are not wheelchair or elderly friendly. So most of these houses are designed in split levels. This used to be the trend those days, but nowadays you see buildings and houses going flat or having more spacious staircases, which is much more elderly friendly. In hospitals or in some malls, you tend to see this marks or signage on stairs. So stairs should be designed to a certain level, which is elderly friendly. With color differentiation, it helps us in our judgment. It helps us in our in how we perceive our steps moving upwards or downwards. We also tend to forget about shoes. Okay, and attires. This is one important factor that leads on to falls. Now, most of the time, you know, we're into fashion, so we like to have open shoes, we like to have heels, but, you know, I would advise as we grow older to have better shoes, better padding, flat shoes are better, and it should be covered. Okay, covered shoes helps you with little small injuries that you don't notice, or it also helps you with a better grip to avoid slips and trips. Also, if you notice, I don't know about you guys, but you know, Malaysia is known for kain pelikat, be it Chinese, Malay, or even Indians. As we grow, we tend to wear something which is loose, so we wear kain pelikat. Okay, we wear sarongs, and yes, you can wear it, but you should be wearing it proper above the ankle, because once it slides over to the ground, these are little factors that can actually lead to falls, which is forgotten. Inappropriate walking aids. Now, there is a lot of people out there who self-prescribe walking aids, who self-prescribe canes and walking sticks. The moment you lose problem with your judgment of how you stand, of how you walk, sometimes you feel that you're a bit weaker on one side, you know, your kids, your children tend to buy you a walking stick or a cane just to get you stabilized. I would advise, you know, once you think you're a bit unstable in your gait, get yourself checked, you know, at least you have a proper walking aid up to your height. That is definitely very important. Oops, sorry. Another huge factor is drugs and alcohol. Many a times, the elderly, the senior citizens, they not only have 1, 2, even 3 medical problems. So, you know, with multiple medical problems, they come with a whole long list of medications. So it is important to stay put to 1 or 2 physicians who can communicate with each other, because you know, each time you present yourself, say to a GP and then to a hospital, then you go for a holiday somewhere and you go to another hospital, doctors will tend to prescribe medication according to what you present with. You go home, you get confused on to which one to take, which one not to take, and then you end up being in polypharmacy, and most of these drugs actually causes falls as a side effect. And as I've mentioned earlier in my previous slides, bifocal glasses is not something that I would recommend. So if you need reading glasses, as well as glasses for you to wear for long-sightedness, I would advise you to have separate glasses. This is much better and safer. Understanding dizziness and its causes. Now, many seniors report feeling unsteady on their feet. Okay, so it is important to know that not all dizziness symptoms are actually the same. And once you feel that, you have this false sense of movement and it diminishes your quality of life. So what exactly is vertigo? Vertigo is a sensation of whirling, loss of balance, particularly looking down from a great height, and it makes one feel like moving or spinning around the room, which isn't. Okay. There is a condition called BPPV, which is benign paroxysmal positional vertigo, where one would experience a sudden onset of spinning type of vertigo, and then upon moving your head. So a senior might actually notice you're turning over in a bed or looking up to get something off the shelves. Now, BPPV is caused by an abnormality in the inner ear. The bouts of vertigo are actually brief, but they can actually be severe and disturbing. But the good news is BPPV can actually be treated with medications and certain types of exercises and physiotherapy. Meniere's disease. Now, Meniere's disease is actually due to fluid imbalance in our inner ear. And it also causes vertigo combined with hearing loss, and you have this ringing sort of sensation in the ears. Usually it's 1 year. It can actually be treated with diet and certain medications if it's investigated properly. But a more serious cause of dizziness is vestibular neuritis. It is a problem in the inner ear disorder that may cause a person to experience symptoms such as very sudden, severe vertigo, including balance problems. And this is associated with nausea and this abnormal back and forth movement of the eyes called nystagmus. Usually it goes away, so it only lasts for a transient time. But if you're unsure, you experience these, please go and seek medical treatment. Now, this is the fatal type of dizziness, which is a central dizziness. Central dizziness is usually due to disturbance in the central nervous system, due to the interruption of the blood flow to certain parts of the brain. So the dizziness most of the time is accompanied by ataxia. Ataxia is when you have this imbalance, loss of muscle coordination and nausea. If you present with this at a sudden onset, don't hesitate, go to the hospital and get it sorted out, because it might just go for a bit, but it may come back in a day or two with a full-blown disturbance in the blood circulation. One of the most common cause of central dizziness is a posterior circulation stroke. So it's the posterior part of the brain which causes stroke due to a clog in your vessel. Now, the most common type of medical dizziness is due to medications. So there's a whole long list of medications that may actually cause dizziness and postural hypertension, which is a drop in your blood pressure. And certain heart diseases can also contribute to medical dizziness. Not to forget diabetes. You can actually develop chronic dizziness with diabetes, and the common problem, which is orthostatic hypertension. Somehow it's being disregarded and not looked into properly. Now, I'd like to share you this slide, which I've taken over from where I was being trained back down south in UK. These are a list of high-risk drugs that may actually give rise to falls and falls risk. Some of these drugs, the most common side effects is actually drowsiness and sedation, and it also can cause postural hypertension. So antidepressants, antipsychotics that can lower your blood pressure and can actually make you very, very sedated. Antimuscarinic is usually medicines that we use for bladder dysfunction or prostate associated with incontinence. Benzodiazepines and hypnotics, as we grow, we tend to have sleep issues, we tend to have anxiety problems. So, you can easily get this prescription in the GP or primary care. So drugs such as lorazepam, Xanax, diazepam. So if it's not used properly or if it's used chronically on a daily basis, the long-term effect is drowsiness, lightheadedness, and we forget. We wake up in the middle of the night while we're still drugged, and this gives rise to falls. Also, drugs to treat Parkinson's disease. The common side effects is lowering of the blood pressure and confusion. Most antihypertensive are actually drugs with moderate risk that can actually give rise to imbalance and falls. And of course, the lower risk drugs are some of the antihypertensive, which is the calcium channel blocker, nitrates, and some oral antidiabetics as well. So prevention is definitely better than cure. Now that we know what are the risk factors for dizziness and falls and what it can actually cause us, I mean, we don't want to end up in the hospital due to a big fall with an intracerebral bleed, with fracture, which is not uncommon in the elderly. So why not prevent? The more muscle you have, the more feedback you're going to give to the brain. So it gives you a feedback about where you are in space, how balanced you are, and how to prevent falls. So I would actually advise one to go for regular physical activity, regardless of how old you are. You know, the older we are, or the more senior we are, the more time we have, to be honest. You know, us in our middle age, we work, we go home, then we have to attend to our children, and then you go back to work. You know, there's not much time for physical activities, really. We have to try and fit that time. But the benefit about being a senior citizen and post-retirement, you have all the time to focus on regular physical activity. What you need is just 2.5 hours of moderate intensity exercise a week. So that's not much, really. So if you break it up, it's about 15 minutes to half an hour per day. So if you want to just focus it on alternate days or on weekends, by all means, it's entirely up to you. Just remember, walking alone is not enough. Walking alone is just part of cardio exercises, but what we need to focus on is muscle strengthening. Muscle strengthening activities, mainly for your lower limbs and for your trunk. So lifting up weights, doing yoga, carrying heavy shopping, you know, going for grocery shopping is actually a good habit. So yeah, at least twice a week, you know, that's part of your regular physical exercise. We have the luxury of having maids. We have the luxury of having drivers nowadays. And, you know, as we grow as senior citizens, we have children who pamper us with maids and drivers, etc. Don't take advantage of that situation. You know, try to be as independent as possible, to run chores, to run activities, to go out and do marketing, because this is part and parcel of staying active. These are some of the exercises pertaining to those with risk of falls. You know, what you need to do is focus on your lower limbs and also your trunk. Calf raises. Calf raises is when you raise up your calf at the edge. So you can use a chair or a table as your anchor with your hands, and then you start doing calf raises. Up to 10 repetitions. So you can do this for 5 minutes in the morning, 5 minutes in the afternoon during your free times, or you know, just before watching television, you can do that. It doesn't take long to do this. This is just to enhance the calf muscles and also the thigh. One leg stand is another good practice that you can do. You lift up one leg, and the other leg is stagnant, holding on to the floor, and you hold on to either the side of the wall or the edge of the chair. So lift it up for 10 seconds, do it repeatedly for 10 times, and then do it on the opposite side leg as well. This is an example of a sit to stand. We use this as a test to look into how mobile a patient is, to look into their risk of falling as well. So sit to stand is actually good to enhance the muscles over the thigh and also your trunk. But what you need to do is to ensure that you're actually at the edge of the chair, and before sitting down, you've got to make sure that the back of your legs is actually touching the edge of the chair before you sit down. So again, do this repeatedly for 10 counts. You can divide it into certain parts of the day as part of your short physical activity. If you're unsure of how stable you are, if you're unsure on what other muscle strengthening exercises that you should be focused upon, you can always go to a physiotherapist for assessments after a medical review. So looking into prevention methods for falls obviously starts from home. So for those who has cluttered house, you ought to be removing hazards, because, for example, you have carpets and you have books distributed everywhere, and the table is also full. So this actually gives rise to fall. You can actually use carpets, but do ensure these carpets are actually layered to the one which is which can actually stick to the floor, because sometimes due to the poor judgment, you tend to just slip onto the side of the carpet and you fall. Time to declutter your home and ensure that you have adequate lighting in the house. This is one good example of a minimalist sort of house where you have proper lighting, you actually have minimal furniture, and most of the stuffs are actually kept in cabinets. Grab bars for those who think that you have issues with your balance, for those who think you need some help trying to get yourself up from a sitting position. Yeah, you can start modifying your bathroom, for instance.
Sorry, Dr. Nordiana, could you wrap up in 2 minutes?
Yeah,
2 minutes.
almost done.
Thank you. Thank you.
Vertical grab bar, folding grab bar, horizontal grab bar, and even raised toilets. Avoid doctor or hospital hopping. Yes, some of us love to see the doctors. So you try to avoid going to see multiple doctors because you tend to get multiple prescriptions as well. And if you think you have a whole long list of medication, it's time for you to have a proper medication review by the doctors. Some of the warning signs post-fall is something that you want to look out for. If the fall is associated with high fever, severe headache, or neck stiffness, convulsions, which is vomiting, head trauma associated with loss of consciousness, sudden weakness or inability to move the arm or legs, that's a sign of possible stroke. If the fall is associated with chest pain or shortness of breath, or a major fall, please don't hesitate, come to the hospital. Now, I'd like to share with you a site that was prepared by a couple of us in the Ministry of Health, the Geriatricians, which is dondangsayang.com, caring for the older people. So we have a lot of write-ups here that you can refer to with regards to the senior citizens. Onto how you care for people with stroke, how you care with people who fall, what are the falls risks, dementia, for instance. And big thanks to Dr. Nur Azlina, who's also my colleague in the Ministry of Health, who's actually put up an article on keeping safe at home for the elderly. So thank you for listening, and thanks for having me.
Thank you so much, Dr. Nordiana. We have some time for some Q&A, some questions. Let me just read from Q some of the questions from our participants. Okay, we have one from Grace to you. My mom is 79. She fell from the staircase, broke her left shoulder up to the arm. She got hospitalized. Doctors don't encourage surgery due to the brittle bones. How do I prevent further falls for my mom? Since then, she's been in a nursing home on a temporary basis.
So it all depends on whether she's had any fractures. Okay, it all depends on how much is the muscle power. I would advise her to be assessed by a physiotherapist or at least an orthopedic surgeon or a geriatrician or neurologist to have a proper assessment to know how much she fares moving forward. Because if surgery is not an option, I suppose, possibly the heart condition, etc. So, you want to try and avoid frailty in the future. You want to try and avoid falls, but being bedridden or just chair-bound alone is not going to help the trunk and the muscle strengthening. So yeah, I would advise her to be assessed proper in order to have a future plan.
All right, thank you. We have another question from Leanne Chan. So does that mean that multifocal lenses are not suitable for the elderly?
Yes. I would say yes. The reason being multifocal, if you tend not to have, if you forget to actually use which lens for which, you get confused in between, and what you see is not the actual judgment of of the real thing. So you may not step properly, especially on the stairs or going downstairs. So researchers have actually shown that multifocal does increase the risk of falls anyways.
Okay, thank you. And we have a question from Melinda Howe, vertigo. What medications are appropriate for this condition?
For what, sorry?
Vertigo. I don't know how you pronounce it. Vertigo.
Vertigo. Okay.
Yeah.
There are many. Yeah. So there are many medications there. Some of it is beta histine. But before actually diagnosing yourself with vertigo, I would advise you to seek a proper medical check, to see an ENT specialist first to ensure that it's not vertigo. You can actually self-prescribe some of them in pharmacy, believe it or not, in our private pharmacies, because for us to prescribe a certain type of medication for vertigo, you got to also link it up with some other medical issues to ensure there is no medicine interaction, and also you want to avoid side effects for the patient themselves. So it's pretty much individualized.
Okay, very good. A question from Margaret Yap. Which type of specialist should I visit for dizziness?
Depends on what dizziness is associated to. Depends also on the age. You can seek assistance from the ENT specialist. You can also see neurologists. You can see geriatricians, people like me, geriatricians, because we look at it as a whole. And if there is any subspecialty that we need to refer them to, then we would. Yeah.
All right, great. And a question from Shi Hui Bo. Can BPPV be cured? If not, it can be cured. Okay, if not, is there any way to reduce its occurrence?
Yes, it can be cured with medications, and there are also some exercises that can actually help to reduce the symptoms of BPPV.
All right, fantastic. We have a question from what's the name, Jin Kaur. Is it okay for seniors 65 years old and above to go for MRI procedures? Any side effects?
MRI, you mean? So
yes, MRI, yeah.
MRI scans.
Yeah, that's right.
Yeah, MRI scans are pretty safe. If you've had surgery more than 10 years ago, then you have to get it checked, because you may have some plates or iron plates in your body which may not be MRI compatible. But nowadays, MRI are better scans compared to CT scans, depending on what you want to look out for. If you're unsure, whichever doctor who's planning out for MRI, you can always discuss with him or her to know what is appropriate, really.
All right. Thank you so much, Dr. Nodiana. Yeah, this is all the questions we have for you today. Thank you so much for sharing your insights on dizziness and all that. I can relate to that because I do have an elderly mom who had 3 falls 10 years ago, and she's now recuperating in a nursing home. Thank you so much.